Coming up, we are going to unpack the new study by the American Cancer Society that has the medical community, advocates, and thrivers a buzz. Now, this study, we're going to take a deep dive in it, but it's showing the increasing risk of breast cancer among the young, and also this new statistic that shows the highest rate of breast cancer are in women in their 20s, 30s, and 40s. Now, the next thing we're going to do, we're going to finally settle the debate between traditional medicine and holistic medicine as it relates to breast cancer treatment. And lastly, the cost of breast cancer. This is a topic that we don't talk enough about, but it impacts so many women across our country. So we're going to really try to help you navigate that space. So I'm Dr. April Spencer, co-host of Urban MD TV, and you are watching our Breast Cancer Summit in 60. Now, let's get right into it. Before we even begin, I want you to subscribe to Urban MD TV on all social platforms. That way, you will be the first to know all of what we're doing as it relates to medicine in our community. And of course, with this virtual summit, we definitely want you to like and share. So let's just get into the state of breast cancer in America right now. The statistics are startling. We still have over 300,000 women that are diagnosed with breast cancer annually, and over 40,000 women are dying from this disease. And of that number, African American women are disproportionately affected. We have a higher mortality rate, actually about 40% higher than our white counterparts. And also, we're more likely to be diagnosed at any stage at a more advanced stage in this process. So we've really got to take a deep dive into it. I have a special guest with me today, Dr. Keisha Reddick. She is a double board certified OB-GYN and the Vice President of Medical Staff Services at Memorial Hospital in Savannah, Georgia. Now, Dr. Reddick, I saw that American Cancer Society study, and it was startling that we finally are seeing an increase in breast cancer cases over the last decade, about 1% per year over the last 10 years. And particularly in women in their 20s, 30s, and 40s, there was a 1.4% increase year over year. We also saw an increase in the rate of breast cancer among Asian Americans and Pacific Islanders. And traditionally, this group had the lowest rate of breast cancer. And then finally, one of the things that really was shocking to me is that we don't really have a clear idea as to why there's been this sudden increase in breast cancer amongst the young. So I'm really curious for our audience to know, how are you guys managing these statistics in these women that are at childbearing age, that oftentimes are getting diagnosed with breast cancer at an age before the screening guidelines, which is age 40. So what do you make of this American Cancer Society study?
Well, thank you, Dr. Spencer, for hosting this summit and inviting me. I think in particular with women, I think it's just very worrisome with younger women being diagnosed because oftentimes when you're thinking about cancer in general terms, people consider it a disease of someone in their fifth decade of life, sixth decade of life. So no one ever really thinks it's going to happen to them. So I applaud, the study because it's giving acknowledgement to a group that probably didn't know or had any clue that, hey, you could be impacted with breast cancer. I think there's a lot of different factors that are impacting why people are getting diagnosed earlier. Sometimes there are, patients who may not be aware that there's actually something wrong. I
Yes.
think we're all think, hey, this can't possibly be cancer. I'm young. There's no way this could be something going on with my breast. So we may talk ourselves out of it. Or, you may not have someone that is going to say, yes, you need to have screening or you need to go be sent for a mammogram or an ultrasound because there's no way this is going to happen in a 20-year-old or a 30-year-old or early 40-year-old. So I think that's part of it. I think the other part is limited access. Currently in some states, there are obstetric deserts. So you have places where there's not an obstetric provider within 50 miles. That may be the same for someone who doesn't have access to a primary care physician. I think OB-GYNs are in a unique position because most people don't necessarily see a primary care physician. Their OB-GYN is their primary care physician. So
And
it
then
gives part of that
are you guys
opportunity.
are you guys seeing some of these women showing up to the emergency room or urgent care to get their primary care?
I think that is happening, especially now that we have more urgent care facilities that are, in closer to neighborhoods.
Mhm.
But unfortunately, patients may be confused about what is primary care and what is urgent care. They may go and say, "Hey, I feel something," and they're then directed to their primary care physician to get referred for whatever imaging studies, and then that's where the gap happens. So I think there's all of that. And then, I think people in society have more stressors. Okay. The
Mhm.
stressors we have today weren't the stressors we had 10 years ago, 15 years ago, whether it is, environmental stressors that have always been present or the things that they may have, stressors with finances. I think with people having access to information, sometimes misinformation, all of those things can, I think, impact someone's health where they would have otherwise not known about it. Um, with patients who are pregnant, though,
Mhm.
that's a very unique population. Breast cancer is actually the most common cancer that could be diagnosed in pregnancy. It occurs in about 1 in 3,000 to 1 in 10,000. And that may not seem like a lot, but if you think about what these stats are, it probably is going to increase if we're, being very vigilant with patients and inquiring them about their health care. The unique thing with pregnancy, though, is that those patients still need to be treated. This does not mean someone needs a delay in diagnosis, which I think happens with a lot of the younger patients, is that things are delayed because, hey, you're young. There's no way you could probably have cancer, right? There's no way I have something wrong with me. But along those same lines, with a patient who is pregnant, because you're a captured audience, if you will, we have the opportunity to diagnose. We can't screen, but we can diagnose patients and treat them. So I think the driving point, at least from the pregnancy side, is that even if you do have it, there are options for you while you're pregnant.
Now, Dr. Reddick, how will a woman know the difference between just lactational or pregnancy related breast swelling versus something to be a cause, there to be a cause of concern? So, if you have a patient and you're educating them on how their body's going to change during pregnancy, what are, say, some of the top three things that patients need to be aware of that could be a red flag while pregnant so that they can come in and get this worked up so they'll know whether or not this is a breast cancer versus just a normal pregnancy or hormonal related change in the breast.
That's a great question. I always respond to patients with number one is, you know your body better than me. Okay. So if you feel like there's something different about your body, even if you think that it may be pregnancy related, you need to talk to me about it because I need to do a thorough exam on you. Certainly, if you have any type of abnormal discharge, women, when they're pregnant, can start lactating early. So,
Hmm.
if there is something that you're concerned about, even if it seems like it's lactating milk coming out of the nipple, I want you to tell me because I need to know, is that really what you're seeing or is it something else? Any skin changes, if you're having any skin changes with your breath. And then, obviously, if you feel any type of discrete mass, sometimes that's hard to differentiate when you're pregnant or even when you're lactating. And in the postpartum patients, they can have infections, they can have mastitis, but that also could be an inflammatory breast cancer. So, I think the driving point that I like to give patients is if you see something, say something. I don't care if you think that it is normal. I want you to tell me everything that's going on so that we can ensure, is this a normal finding or is this something we need to investigate more?
Okay. So it sounds like you're really trying to impart upon patients the importance of advocacy, being their own advocate. If they see something, say something. Don't allow anyone on your healthcare team to dismiss your concerns. And if it's something different, make sure you just speak up and speak out. I also just want to add that patients need to be aware if they are pregnant that you still can get a mammogram. I know a lot of times clinicians may shy away because of the radiation, but can you just speak to how it is still important if you do feel something or see something during pregnancy, you still can advocate to get a mammogram and or an ultrasound with shield?
Absolutely. Absolutely. So in general, when we have patients that we're concerned about, we must always generally start off with an ultrasound, but that does not mean that a mammogram is not indicated. And again, if you have a patient that you're concerned about malignancy, then we need to do all of the appropriate tests because we want to make sure we're getting you the adequate treatment during pregnancy. And I think, sometimes again, it's hard for patients to advocate because it's scary territory, right? I'm pregnant, I have a baby growing inside of me. I don't want to make the wrong decision. I'm nervous. What if I get diagnosed with something? I always tell people, you know what? It's power in knowing, right? There's power in the knowledge about what's happening with your body. And so sometimes that takes us down a pathway of things that you may not otherwise thought you could get while you were pregnant, but it's actually indicated.
Yeah, but can be one of the most frustrating times because on the one hand, you're celebrating the upcoming birth of a child, and on the other hand, you're literally having to fight for your life. And oftentimes, these breast cancers are very aggressive because, again, these patients are young, childbearing age, and it's hormonally driven. So it's really important that we get right on top of it. So thank you, Dr. Reddick, for sharing that key information. How can people find you?
Well, like you mentioned earlier, I am a maternal fetal medicine specialist in Savannah, Georgia. I'm available to see patients who are high risk. Again, that includes patients that have cancer, but I also see patients preconceptionally. So for patients who may have a history of breast cancer and they want to talk about what are the chances for them to be pregnant, what are the chances that they may have a recurrence, or how I will manage their pregnancy. So again, I'm available here in Savannah for any of those needs.
All right. Well, thank you, Dr. Reddick, for your time.
Thank you.
Now, one of the biggest decisions that a woman has to face when she's diagnosed with breast cancer is how am I going to manage to fight this disease? Many women have never had cancer before, particularly breast cancer, and it's really difficult to make sense of what the next steps are. Now, there's this never ending debate as to whether or not you should pursue traditional breast cancer treatment or holistic or a little bit of both. So let's just talk about the differences in the treatment. So in general, your traditional treatment, as we know it, will include surgery of some sort on the breast. That's either a mastectomy or partial mastectomy. Many women will also need to have radiation involved and some sort of chemotherapy, either by IV or by mouth or both. On the holistic side of things, usually this involves taking supplements. Sometimes that can be by mouth, oftentimes that can be by IV. But many women that choose the holistic route may also choose to forego surgery and mainly do lifestyle changes such as diet and exercise, resting more, stressing less. So many people have the right idea and wanting to use this as an opportunity and not an obstacle to be a better version of themselves. But oftentimes, this can be detrimental if you are choosing one versus the other. And so, what research shows is that the best outcomes is when we tend to complement them and we're doing both. But someone that may know a whole lot more about this is a breast cancer thriver, Thandi Montgomery. She was diagnosed at the age of 38 with breast cancer and managed to rock through this disease. So thank you so much, Ms. Montgomery, for joining us today.
Thank you for having me here.
Wonderful. Now I'm just going to get right into it. How did you even know that you had breast cancer? You weren't at a screening age, you weren't 40, you were only 38 years old. I understand you were diagnosed during the pandemic
Yes.
when there was even more limitation to access to breast centers for even getting a mammogram and even seeing a healthcare provider to get this worked up. So just walk us through how did you discover your breast cancer?
Absolutely. So at a very young age, we were taught to prioritize our health. And so I was so accustomed to every month around my cycle to do my own self exam. I would say I was diagnosed on November 1st, 2021. It was almost 3 years to the date. And so prior to the diagnosis, I was doing my monthly exam. It was in August, and I
Mhm.
found a lump. It was the size of a pea. Now, mind you, 2 months prior, I had had my well woman's checkup. There was nothing there. And so this was, of course, a surprise. Breast cancer does not run in my family, but we do have very dense breasts. And so I'm
Mhm.
always very cautious to make sure I check the girls every month. And I'm glad that I did check the girls in August of 2021.
And
Uh,
Thandi, I have to just jump in really quickly in terms of breast density and add a little bit more clarity to that. So, breast density is just the structure of the breast that's more firm. Many of us have breasts that are primarily composed of fat as we age. So, if you have dense or thickened breast tissue, fibroglandular tissue, oftentimes it makes it a little bit more difficult to see a mass on mammogram or even ultrasound because it looks just like your normal breast tissue. So did you run into that challenge with having dense breast tissue when you got your mammogram or your exam because they didn't feel it, right?
Absolutely. And so when I first went in, I had a mammogram and an ultrasound, and they said, well, you have very dense breasts, so we don't see anything, but just to make sure, I want you to come back for a biopsy. And Dr. Spencer, I am so glad that my team of doctors were so careful, because if I did not go back, or if they didn't invite me to come back for the biopsy, I don't know what would have happened since then, but I went back in for the biopsy, and then hours passed, days passed, weeks passed. It was silent. So I thought that everything would be okay. And then November 1st, 2021 at 4 o'clock p.m. Came around, and my PCP told me that I had invasive ductal carcinoma, but I
Oh,
had
wow.
no idea what invasive ductal carcinoma was. So I thought, was that a new strain of COVID? What was that? So I wasn't worried at the time, but then she looked at me and she said, Miss Montgomery, you have breast cancer. And again, 38 years young.
Yeah, that is a very young age. Now, just going back to that moment, can you recall any sort of stressful events or any significant events that were going on other than COVID and trying to manage that? Because there's a lot of research that shows a lack of rest and stress increases your fight or flight, and that compromises your immune system. Your immune system is what keeps cancer at bay. But can you recall anything that may have happened during that window?
Absolutely. So as you mentioned, we know it was COVID. I had two young kids at the time, ages 8 and 5. I was
Mhm.
at the peak of my career, a marketing executive in a major advertising agency. And so having to homeschool the kids, COVID, having
Oh,
to
wow.
working with clients, that never stopped. And so I would say I was at the most stressful time of my life during that time.
Yeah, so it's important for our viewers to understand the importance of our mental health and really striking a balance, and how there is a lot of research that shows the correlation between mental and emotional duress with the manifestation of physical disease. So we cannot emphasize self-care enough. Now, let me just ask, what treatment plan was proposed in the beginning?
So at the very beginning, I was initially supposed to have a double mastectomy and then
Mhm.
have reconstructive surgery and get back to my 5-year plan in terms of just my life and my career. However, after the double mastectomy, when I went back in for my follow-up appointment, my doctor told me that the cancer had spread to my lymph nodes. And so the anticipated 2-month journey, the double mastectomy and reconstruction, was expanded to 12 months. And so that was 16 rounds of chemo, 30 days of radiation, and 4 surgeries.
And like once that decision was made and you realized that you would have a much longer course, what did your family or friends advise once you had to somewhat pivot and have a different treatment course?
And I received mixed emotions, mixed thoughts. Some people wanted to pray it out. Some people wanted to do chemo and make sure you go that route. Some people were like, you should go to Arizona or Mexico and get the holistic treatment. And so, as you can imagine, that was one of the most difficult times making the decision. So, besides losing the hair, besides losing the 34 C's, making the decision in terms of what was the right path was very difficult. And being a marketing executive, I do a lot of research. And so, aside from getting advice from the north, south, east, and west, I had to come to the conclusion to figure out what was best for my body. And so we did research on holistic care. We did research on conventional care. And
And
so
what did you decide?
we decided to marry the two. And oftentimes it's either or. We wanted to
Mm.
marry the two and do both.
Yeah, and I really want to emphasize that you don't have to choose. We have seen the best outcomes when patients engage in complementary medicine, and that is moving forward with a personalized plan, whether that's surgery, chemo, radiation, not necessarily in that order, but to continue with the lifestyle changes where you are making sure you're eating well, exercising, stressing less, and getting more rest. Now, when your treatment took a course where you had to be out longer, how did that impact your family dynamics in terms of the, logistics, financial piece? I'm sure you were juggling a lot of things all at once.
Absolutely. And so I decided to take off a year from work so that I could really focus on my health and my family. And to your point, oftentimes, especially as women, we have on this superwoman cape and we try to do
Mm.
everything. But I decided that when I was diagnosed that I would take off my superwoman cape, burn it, and really call in my squad for backup because there was no way that I could have gotten through that without my team of doctors, my coworkers, my family, and my friends.
Wow. Well, I applaud you for being a breast cancer thriver and just sharing your story. You have inspired many of us. And the takeaway here is, of course, to be your own advocate. Secondly, that it is okay to integrate both methods. You do not have to choose to have the absolute best outcome. Again, you want to do your research and do what's right for you, but your medical team is designed to come up with a plan that is going to give you the best chance of survival in terms of short term and long term. So, thank you so much for sharing your story. And we wish you all the best and the rest of your journey from your breast self to your best health. Thank you, Thandi. Now, I had a patient recently that was diagnosed with breast cancer, and immediately she, of course, like many women, just burst into tears. And I'm connecting with her and reassuring her that, listen, you're going to have a great treatment plan. It's going to be personalized. And I began to go through that process as I do many patients. And she looked at me and said, I'm not worried about the treatment plan. I am worried about how am I going to pay for all of this? And so many patients want to have access to resources because the cost of cancer care is just something that we just don't talk about enough, but it's very real in our lives, just something that you just can't plan for. So today I have a very special guest. We are so lucky to have him, Jean-Claude Fresnel. Thank you so much for joining us. How are you today?
Great, great. Thank you for having me.
Okay, it is a pleasure. Now, you have wonderful resources in terms of your company. Can you tell us a little bit more about that?
Yes, we have Lenserf Company is the company that I founded in 2008 after being in the industry for about 10 years. We support companies with their benefit packages that they provide to their employees to enhance their total rewards and retention strategies.
And have you had a personal, I know you've had a very professional relationship in terms of teaching companies how to navigate the cost of cancer with their employees, but is this something that's ever hit close to home for you? I think you were sharing with us when you had a scare with your mother-in-law, and
Yes.
she had to be on that side of managing the cost of cancer care.
That is true. There was what we experienced with my mother-in-law was a wake-up call to where your the buck stops with your health insurance. It was an 18-month battle with her fighting for her life as she was diagnosed with breast cancer. Best treatment for her to support her was not here in the current state that she lived in, but it was actually flying back and forth to Illinois for the best treatment. So even seeing what all it came into play with the treatment for away from home, as well as the support that provided with her, with us taking turns to fly back and forth to Illinois to support her, as well as in the final stages of that battle, with having to have an air ambulance return her back to home to set up hospice. You really saw where the buck stopped with your health insurance in a situation that severe.
Now, most people, Jean-Claude, can't plan for cancer, particularly breast cancer. Oftentimes, when women are diagnosed, they are retired. But as the new American Cancer Society study is showing us that these women are also being diagnosed at younger ages where they are uninsured or underinsured. So, what types of resources exist out there for someone, first of all, that doesn't have a diagnosis of breast cancer? Do they need to just be proactive and consider maybe a plan that protects them in the future, whether they're young or in the older population?
Yeah, well, early detection is the best way to prevent anything from a standpoint of the diagnosis. Similar to that with the insurance coverages, to avoid those areas of risk and having those bases covered along the way. Proactively looking at solutions like voluntary benefits. There's several voluntary benefit carriers who have the specific cancer coverages that employees can take a look at. For those who have family histories of cancer, they could keep that in mind as well. But taking time out during their open enrollment at their workplace for those who are employed to take a look at what's available and hear and see if those voluntary benefits are accessible to them at their place of employment. Other options are
Mhm.
with some life insurance programs have accelerated benefits of chronic illnesses attached to them that they can add to their life insurance programs to support them more or less along the way if they can't do two or more active activities of daily living. Some of them will kick in to support them during that battle as well.
So it sounds like there's a lot of robust resources for people that are insured. Now, are you aware of any resources for young women that may not have insurance or may be underinsured, or for the women that are on a fixed income because they're retired and maybe need some supplemental support?
Yeah, so there's typically a nurse navigator or patient advocate or patient navigator at a hospital that can support when that person is diagnosed with something as severe as breast cancer and navigate them through one, seeing what can happen if they're under the age of 65 and qualifying for emergency Medicaid coverage if they don't have any coverage at all in place. Also navigate walking them through the process, connecting them with their employer to understand if Family Medical Leave Act could assist them even with their time off that they will need to battle that storm, as well as looking at state and local emergency care programs. Every state is different, but there are also state and local services with emergency care to support them with medical issues and bills as well.
Yeah. No, that is key information. And so we really want to make sure the takeaway in terms of the cost of cancer is one that you can be proactive and prepare for that and seek out policies that have a cancer policy built in. Also, policies that don't penalize you for pre-existing medical conditions if you've been diagnosed with breast cancer in the past, because there's always a risk of recurrence. And then finally, for women that are uninsured or underinsured, just be mindful that there are state, federal, and county resources. Oftentimes, the nurse navigator or the patient advocacy um, unit in the hospital will always have these resources, because it's really difficult when you say, Jean Claude, to try to tease all that while you're trying to manage a new cancer diagnosis. I'm sure that's what you experienced with your mother-in-law. Even though you were an expert in it, it must have still been daunting, right?
Yeah, you do have the physical, the mental, financial, and the spiritual aspect of it as you're going through that process, regardless of the diagnosis, and seeing how all of those components are impacting the person as well as the family member and the resources around them. That they all plays into the level of support that you can have, especially with a nurse, a navigator who could support them as an additional resource, an extension to their family, to letting them know some options as they've seen this before, and some options that the family may not be aware of, and be accessible to them.
Yeah. Well, I am so appreciative of you sharing that vital information about the cost of breast cancer. So I'm hoping our viewers are taking notes on that and just know that they can and will be fully supported, but you just have to be aware of what the options are so that you can self advocate. Now, I definitely want to thank all of our guests today, Dr. Keisha Reddick and Thandi Montgomery and Jean-Claude, just for lending your time and your expertise. And we are hoping that our viewers do not forget to subscribe to Urban MD TV on all social platforms so that you can be informed and be the first to know when we are having summits like these that are very educational and life changing. And so, one of the things we want to make sure you do before you go is make sure you like and share. And you have been watching the Urban MD TV Breast Cancer Virtual Summit in 60. And we are hopeful that you remember the 3 takeaways before we end. One is that although there's this increased risk of breast cancer among the young, brought on the American Cancer Society study, that you have resources. Make sure you advocate for yourself and make sure that if you see something, you say something. And next, of course, we have to make sure that we are always mindful that you don't have to choose when it comes to traditional and holistic medicine. We find that the best outcome, ladies, is when you complement all of these modalities for a wonderful, wonderful treatment throughout the process. And then, of course, lastly, the cost of cancer. I'm hopeful that this has been helpful. And if there's something that you need more clarity on, or if you have questions, make sure you drop them in the comments. And thank you so much for joining us. Again, this is Dr. April Spencer, co-host of Urban MD TV, and you've been watching our virtual breast cancer summit in 60.